Heart failure presentation by Victoria Taylor. What is heart failure? Heart failure is a condition in which the heart can't pump blood efficiently to meet the body's oxygenation and nutritional requirements. Causes and risk factors for heart failure are high blood pressure, heart attack, coronary artery disease, diabetes, congenital heart defects, family history, obesity, African American background, smoking, alcohol use, and heart dysrhythmias. And according to the American Heart Association, 1 in 5 Americans will develop heart failure in their lifetime. Prevention for heart failure. Some of these prevention methods include a healthy diet, so avoiding fatty and salty foods, cardiovascular exercise at least 3 times a week. This may include walking, riding a bike, swimming, just anything to get that heart pumping. Smoking cessation. Smoking causes vasoconstriction of the blood vessels, and this increases your blood pressure, which we already mentioned that is a cause or risk factor of heart failure. Controlling conditions such as high blood pressure and diabetes, maintaining a healthy weight, and reducing and managing your stress levels. Diagnostic tests for heart failure. Some of these include blood tests, which may be a CBC, an ABG, or even a BUN creatinine, chest x ray, an electrocardiogram, an echocardiogram, or cardiac catheterization. Now, in heart failure, there are two different types. You have right versus left heart failure, and I will talk about those next. Left-sided heart failure. When you have left-sided, you want to remember lefty lungs. So left-sided heart failure is when the left ventricle cannot pump enough blood to the rest of the body. Signs and symptoms may include dyspnea, orthopnea, cough, hemoptysis, crackles, and pulmonary congestion. Right-sided heart failure. When you have right-sided heart failure, you are going to have more systemic issues. So when you have right-sided heart failure, you want to remember right is body. Right-sided heart failure usually occurs after left-sided heart failure has progressed and gotten worse. Signs and symptoms include anorexia, nausea, weight gain from a retention of fluid, hepatomegaly, which is an enlarged liver, peripheral edema, ascites, and jugular vein distension. Treatment for heart failure. So some of your treatments include medicinal management. This includes use of angiotensin receptor blockers, or also known as ARBs. Beta blockers, diuretics, and calcium channel blockers are just to name a few of the medications that you may take or give to a patient with heart failure. Nutritional management includes a low sodium diet, around 2 to 3 grams a day, and fluid restriction. You also want to eat lean meat, fruits and vegetables, monitor your carbs as well, just an overall healthy, lean diet. Surgical interventions may include, unfortunately, a heart transplant. Other therapies may include oxygenation, physical and occupational therapy to help your patient deal with the new diagnosis of their heart failure. Fluid overload. Fluid overload is a complication that can occur with a patient with heart failure. Fluid overload is also known as hypervolemia, which is where there's too much fluid in your blood. This is also known as pulmonary congestion, And this pulmonary congestion is a hallmark stamp, you know, it's a really big sign for patients with heart failure. It's caused, when you have low cardiac output, arterial underfilling, activation of neurohormonal systems, and dysregulation between the heart and kidneys, which really means is that basically your heart and kidneys aren't working together. Because your heart is not working properly, it's causing your kidneys not to work properly and filter all your fluid and your sodium, which is being contained when you have fluid overload and when you have heart failure. So here we're going to look at a patient with heart failure. This is Cynthia. Cynthia is a 65-year-old African American female. She has come into the hospital today complaining of shortness of breath, orthopnea, and swelling in her extremities. Cynthia has a medical history of type 2 diabetes, COPD, high cholesterol, hypertension, obesity, and a recent diagnosis of CHF. For our plan of care for Cynthia, our ultimate goal is to improve her gas exchange and decrease the fluid retention that she's having. For I've seen a few patients in fluid overload, and during my assessment, the patient is very anxious because they can't breathe. They're having this shortness of breath. They may be swelling in their extremities. They may be exhibiting JVD. Their lung sounds are also going to sound very wet, so you're going to hear those bilateral crackles. To the right, I have listed just a few of the nursing interventions that you may do with a patient in this acute situation of fluid overload. And hopefully, with these interventions, our outcome will be increasing that diuresing of the patient and getting that fluid off their lungs so that their gas exchange will improve. Next, I have my algorithm and how I would deal with this patient um, experiencing this fluid overload. So, as I mentioned in the assessment, patient is anxious, shortness of breath, swelling. The patient may even state that I can't catch my breath or that I feel like I'm drowning, and which they can because that fluid is there on their lungs, so it makes them feel like they're drowning. So, what I would do first with my patient is elevate the head of the bed. That's gonna increase their oxygenation and their gas exchange, open up their lungs. Then I would apply oxygen. And I would see if this is helping some of that breathing issue resolve. If yes, I'm going to continue to monitor my patient. Maybe it wasn't, from the fluid overload. Maybe this is something else, another issue for the patient. And then I'm going to provide patient education on managing their disease. If no, then I'm going to notify my doctor that my patient is having this acute situation of fluid overload. I'm going to recommend that we start on Lasix. Usually they start around 20 milligrams of Lasix IV push. And with Cynthia's age, I'm going to recommend that a Foley be placed. That increases her safety, and that also allows us to measure how much fluid is coming off of her. Next, we're going to administer the Lasix, place a Foley, and I'm going to ask myself, is my patient diuresing? Is that fluid coming off? If yes, I'm going to continue to monitor my patient, assess their vitals, their intake and output, then assess those lung sounds to make sure that the crackles are going away. And to continue with that, we're going to monitor their weight after that, monitor their fluid and their sodium, put them on restrictions. That'll help with preventing the fluid to come back on them. We're going to monitor electrolytes, especially potassium and sodium, because with Lasix, they can get rid of all those electrolytes. And then we're going to provide patient education on managing the disease. If no, or if my patient isn't diuresing enough, we're going to try to increase their oxygen to help them breathe better, and we're going to also increase the Lasix. And if my patient is improving, of course, we're going to continue to monitor after that. If not, I would call the doctor once again, recommend that maybe we do Lasix and a thiazide. I've heard that this is a powerhouse for getting that fluid off the patient they're not uh, if they're not responding well to just Lasix alone. Hopefully with this last one, the patient is diuresing, the crackles are disappearing, the shortness of breath is decreasing, and their gas exchange is improving. Once again, after this, we're going to continue to monitor vitals, intake and output, electrolytes, food and sodium restrictions, and provide patient education. Education, education, education. So overall summary for a patient with heart failure and this acute fluid overload episode, we're going to assess, start with our ABCs, maintain that airway and breathing, help with diuresing that fluid, getting it off their lungs. Once that is better and our patient has improved, continue to monitor your ABCs, monitor that intake and output, and monitor their electrolyte levels. And here is a list of my references that I used. A lot of this information had similar information. They backed each other up, and they also provided me with nursing interventions and knowledge about heart failure. Thank you for listening.